Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Cannabidiol, or CBD. Now, those products have become increasingly popular with patients who are seeking relief from pain, from anxiety, from sleep disturbances, and other chronic conditions. But the question is, are CBD products safe and effective? What's the science? What's the evidence? And what's the latest research?
It's time to find out from two Mayo Clinic experts. Joining us in studio is Dr. Brent Bauer, Director of Research for the Mayo Clinic Integrative Medicine Program, and Mayo Clinic Internal Medicine Specialist, Dr. Karen Mauck. Welcome to the program, both of you.
Thank you.
Great
Thanks
to have you both here. We want the straight scoop on this stuff. So first of all, tell us what this is and compare that to marijuana and other products that are out there.
Want me to start?
Sure.
Okay. So if you think of cannabis, right, the plant Cannabis sativa, many of us may or may not remember from high school, that's the source of marijuana that gets you high. But it's also the same plant bred differently that gives us hemp. And hemp is different because it doesn't have the THC. So one plant, kind of different forms. Hemp, no THC, no way to get high, no psychoactive components that we think of. Marijuana, lots of THC. So there's kind of our difference. And what we're talking about today are things that are derived from hemp, not with THC.
So is hemp the same thing as cannabidiol?
So hemp is one of the best sources of cannabidiol. There's really two main active components in the cannabis plant. THC is one of them, cannabidiol is the second. But there's a number of cannabinoids, so other chemicals that are similar to cannabidiol that are part of the overall plant makeup for hemp. And we think a lot of the cool stuff isn't just cannabidiol, it may be in some of these other ingredients.
We certainly know that there can be trends in medicine, but why is it that there is CBD everywhere now, Dr. Mauck?
Well, I think there's a lot of interest in medical marijuana for treatment of anything from nausea to pain to anxiety. And there's interest now in cannabidiol or CBD because people don't want maybe the psychoactive effects of THC, but they maybe want the effects, the side effects, which are some of the cannabidiol side effects that help with some of these symptoms. And so I think there's a real push to try to find these things that's legal, that will also maybe treat symptoms that are hard to treat with other medications that we have available. So I think that's why there's more interest.
And is there FDA approval, or are we still years away from the FDA catching up to this game?
Well,
you both better comment on that one.
yeah, it's a great question. First of all, FDA doesn't really approve supplements, but what they do is to create that category of supplements. But this really can't be a supplement now because cannabidiol as a purified extract has now been marketed as a drug. So Epidiolex is the drug form of CBD that's been studied in those two rare epilepsy syndromes, Dravet syndrome and Lennox-Gastaut. Very difficult ones to treat, not many good treatment options, devastating to the kids who have them. CBD comes along and it seems to have a very good effect on those kids. So now we actually have cannabidiol as a drug, which makes the regulatory environment very difficult because technically drugs can't also be dietary supplements. So this is where the FDA is kind of going around a little bit. The federal level hasn't really fully embraced cannabidiol and whether it's related to, does it come from marijuana, does it come from hemp? But the Farm Bill Act of last December has declared hemp as a legal crop. It's no longer considered a Schedule V drug. So we have this kind of sort of permission at the federal level. States are doing their own things all over the place. And in between there, the FDA is saying, wait, we're going crazy with this stuff. It seems to have some promise, but it can't be for everybody. And now we're seeing that it can have drug-herb interactions, and we're seeing it can irritate the liver. So it's not a free lunch. It's not magic for everybody. How do we slow it down a little bit and try and get some of those questions answered? I think that's the take of the FDA right now.
So, but what's the difference between the prescription drug that is available for these seizure disorders, the rare seizure disorders, and what you can get over the counter?
So the purified form is the CBD oil, and the drug form of that is a purified form. What we're getting and seeing that's available on the market are all sorts of, because it's not controlled, we're seeing things that have the cannabidiol the CBD in addition to terpenoids. Sometimes they add echinacea, some other things, a lot of many other chemicals and herbs that can be part of that supplement. And so we don't always know, and it's not controlled. The amounts aren't controlled. So it's very hard to get a hold of the purified CBD. You can, and there's organic certified, I think, we can talk about some of the things that are available, and mostly in Europe, I think, for the most part. But for the most part, what we get here is people trying to sell anything, and even hemp seed oil, and there's really hardly any CBD in hemp seed at all. So it's just a huge money-making endeavor right now, and so I think it's just that's part of the difficulty in trying to control this, and people trying to find the right supplement that works for them.
Well, you can buy it everywhere, at gas stations, at grocery stores, at the video store, strip malls. It is just absolutely everywhere. So is there any way that a patient or someone who wants to try CBD or thinks, I'm training for a marathon and I'm worried about my knees? Just saying, somebody might be thinking this would be a good time to try CBD. How do you know where a good provider is? Is there a list of those providers?
I think a couple steps even before you purchase. First thing you need to do is you need to talk to your doctor, right, or your care team, because we are seeing that the cannabidiol and some of the other elements in hemp can interfere with many drugs. So you may have a very important drug at a good level in your body. Taking cannabidiol may actually accelerate the metabolism and cause it to go too low, or it may inhibit metabolism and cause it to go too high. So it's not a free lunch. Everybody shouldn't just run out and try it. So talk to your physician first. Second thing we're seeing is at high enough doses to be effective, there are at least a few reports coming out of liver toxicity. Seems to be reversible. You stop it and it goes away. But how do you know that? Well, you need to work with your care team to get the blood test and so forth. So I don't think that's don't try it. I think it is, if you're going to try it, let's make it a coordinated effort with our care team. And that's the first step, I think.
And you say try it. Try it for what?
I think the things that we see, a lot of the preliminary data are around pain. And that's one of the interesting things. People are touting this as a way to help treat the opioid epidemic. So in other words, there are some interesting studies in rats that are given CBD seem to be able to get off opioids, seem to get some pain control. There seems to be something there in the preclinical arena. We haven't yet seen large clinical trials where people have said, does this work in humans? Anecdotally, it seems to help with pain. Anecdotally, it seems to help with anxiety. But we're physicians at Mayo Clinic. We have to wait until somebody shows us really good long-term trials that weighs the efficacy against the harm.
And there are all different forms of it. How do you know what to take? I mean, is it best to take it by mouth? Or if you have knee pain, can you rub it on your knee? Or how you can spray it? I mean...
You can get lollipops. You can get, they have it in jelly beans.
Yep.
So there's...
beer.
I haven't heard that.
Beer-infused
CBD
yep.
beer?
Mm-hmm.
No.
So I think the problem with trying it, for example, after we did this article, I wanted to try it because I'm like, okay, let's see what this stuff does, because I have some hip pain or knee pain. I didn't notice any difference, but I think you have to remember that each preparation that you get has a different percentage of CBD and then a percentage of who knows what. Mm-hmm. And so depending on the percentages of CBD, that may affect how efficacious it is for whatever you're trying to treat. So I think even if you try one product, it doesn't mean that maybe you respond, maybe you don't. It may be that it's not in the right percentage. So I think it's very difficult to know what to even try. There are some recommendations from the prescriber's letter that talks about if you want to try these products, to give some names of some products to try and where to get them, because they're more purified and have been tested. And do recommend that if you do try a product, that you have one that's tested for the actual content of CBD and what exactly it is you're taking.
And so where do you get the names of those?
So the prescriber's letter is something that I prescribe to and get information about different drugs. It's like the pharmacist letter, and they have, I think, in one of their supplements some information on where to purchase this. I don't have the information with me, but there are places where you can find this sort of information.
Well, what about our listeners? If they wanted to try it, how do they know what to get, and how do you get it in its most purified
I
form?
just Googled prescriber's letter CBD recommendations, and there it is.
Okay, push it. What's it say?
Well, I'll find out. I'm going to read it when we're done with this
All right,
interview.
we'll put it on the website.
Okay. Well, I'd just say Google it. You'd probably find some of that information. Just look for prescriber's letter.
You know, Tom, I think there's a general question there, and how do we, as consumers, find a good quality supplement, whatever we're using it for? And I think there's a couple things we've learned over the years. We know there's something called good manufacturing practices, and that's mandated in the United States. So first thing you should look for is make sure the product you're looking at meets GMPs. It should say it on the label. There should be some validation. We, when we're doing research studies here on supplements, look for companies that are also certified by the European Union and the Australia supplement regulations. Very stringent. So if you can meet all three, you're doing great. Fourth thing we ask the supplement company to do is make sure they have an adverse reporting structure that's outside of their company. So if you have a company, you're supposed to collect information if there's adverse events. Most companies just take that internally and we never see it. A good company will have an independent company do that so that we can actually track and see if there's things evolving. So I think that's the homework we have to do. We have to find those few companies that are out there that meet those high criteria and then look to them for the products that at least we know might be a little more expensive but have a better chance of being quality as opposed to going to the internet and taking the gummy bears at the local gas station.
We're going to have you guys back when you have some firmer recommendations regarding this. There's been a huge surge in the interest in CBD products, and there's growing evidence to support the use of CBD oils for a variety of conditions, including chronic pain and opioid addiction, at least in rats. The problem is studies on the safety and true effectiveness of cannabidiol are still lacking. Our thanks to Mayo Clinic experts Dr. Brent Bauer and Dr. Karen Mauck. Thank you for being with us.
Thank you guys for having us.